All right, guys, welcome to your medication review video for acetaminophen, otherwise known as Tylenol. Let's dive into it. So Tylenol is an analgesic. It is a non-steroidal anti-inflammatory drug. It does have some antipyretic effects as well, which is going to be our two main uses for this medication. So when we're talking about pain management with this, it increases the pain threshold within the central nervous system, which is why it's such a effective medication for use in management of mild to moderate pain. And then when we talk about fever reduction, it actually blocks prostaglandin in the hypothalamic area of the brain, which is where the thermoregulatory centers within the brain are. It's very effective for the use of fever reduction, mainly used in the pediatric populations, but it does also do the same within the adult population as well. So our indications are going to be pain management. Again, this is going to be for mild to moderate pain, and then it can be used for fever control or fever reduction in both adults and pediatrics. But again, the main use for fever reduction tends to be in the pediatric population. Contraindications, so hypersensitivity. As with any medication, if we have a known allergy or sensitivity to that medication, we want to stay away from administering that to our patients. And then it is listed as a contraindication is listed as children under the age of 3. You will notice I have an asterisk there, and the reason we put that asterisk there is it's not really that it's contraindicated. It's that full dosing Tylenol is really contraindicated in patients or the patient population under the age of 3. Once we hit that age cutoff, we really want to shift to the use of children's Tylenol in those settings for those treatment of those patients. So your dosing regimens. So for adults, your PO, given via pill, what we're most used to, most comfortable with, and probably used to seeing within our own households is the PO administration of a tablet being 325 to 650 milligrams. This is given every 4 to 6 hours, and this is our go-to dosing for management of mild to moderate pain. You do also have options depending on the setting and the system that you work within to administer to adult patients perirectal. This dosing is 650 milligrams every 4 to 6 hours, and you want to be very mindful that your max dose for the adult population is going to be 4 grams per day, or 4 grams in a 24-hour period. For your pediatric population, our dosing regimen that we're shooting for is 15 milligrams per kilogram. We'll do that every 4 to 6 hours. We can give that PO or perirectal. And then again, there's no max listed there. We want to stick to that weight-based administration. One thing I want to point out when we talk about Tylenol is that it is becoming more and more popular in the pre-hospital setting and is used for that treatment of mild to moderate pain. It is being included in many pain management protocols. In particular, Merced County EMS agency does have acetaminophen listed in their adult pain management protocol. The dosing is a little bit different than what we see here. The dosing regimen listed in the current protocol is going to be 15 milligrams per kilogram via IV infusion, so it's infused over a 20-minute period with a max dose of 1 gram or 1,000 milligrams. So again, it is becoming more and more popular. It is becoming accepted use in the pre-hospital setting. So acetaminophen or Tylenol, if your current system is not using it, I would be ready to accept this medication into your system and into your local protocols, probably in a rather short amount of time. So again, this is your medication review for acetaminophen or Tylenol.